to inform you that the Atlantis healthcare system will not provide flu vaccine to our patient for the coming flu season. We all know that flu vaccine was made ahead each year by predicting what strains will be in epidemic. But the effectiveness of getting the most powerful strength is not very high historically. Second, the flu vaccines are not very effective. Every year, the flu case vary in similar range whether the flu vaccine was a match or not. A study of 50 cases, 50 studies cover 70,000 patients, found that we need to vaccinate 100 adults to prevent one case of the flu. For seniors, the statistic even worse. 217 elderly need to be vaccinated to prevent one single case of flu. The CDC reported the vaccination effective rate from 2005 to 2014 varied between 10 to 60%. Third, the vaccines are not without side effects. Many patients develop flu-like symptoms after the vaccination. Some have local reaction, infection. Some even develop generalized allergic reaction. The rare side effects include Guillain-Barré syndrome, which paralyzes your body and has been implicated as increased risk for Alzheimer's disease. Some formulation contain trace elements of mercury and formaldehyde. Also, CDC and other healthcare authorities reassure us the amount was so low that it posed no harm. But in real life, our bodies were exposed to different sources of mercury and formaldehyde all the time and exposed to many other toxins as well. So the accumulated and combined effects of all these toxins over the long term could be harmful to our health. According to Center for Disease Control and Prevention, 60% of the healthcare provider refused to get vaccinated against the influenza vaccine for the 2006 to 7 flu season. The vaccination rate increased to 64.3% last year after many hospitals forced their employees who take care of the patient to get vaccinated, or they have to wear a mask through the whole flu season. This data gives us some clue about how healthcare professional feels about the flu vaccine, who take care of the flu patient day in and day out. After serious consideration of pros and cons, our Board of Trustees and Infectious Disease Committee see no justification to provide flu vaccine to general public. So we decide to follow the first rule of medicine, the Hippocratic Oath, do no harm. The Atlantis healthcare system will not provide flu vaccine to any of our patients for the coming flu season. Questions? Yes, John.
Why should we believe any statistics coming out of the CDC? They constantly have statistics which over the years sometimes contradict each other, and the statistics oftentimes with that group seem to support a position that they're taking. Why is this any different?
Exactly. I agree with you 100%. Like most of the government agent or even the pharmaceutical company, they provide data to their advantage. But because I'm in the opposite position of what they recommend to give vaccine, so I presume their data already are pro-vaccination. And I'm quoting that data probably will be more to my viewpoint against vaccination. You know what I mean?
I think you switched around the is what I think. Yeah.
Also because that's the only organization who provide this kind of data.
Could
Yes.
this viewpoint just be from a health company trying to cut back on costs by telling people not to get vaccinated so they'll save all the money that they would have spent?
You could consider that way, but our Atlantic healthcare system definitely is not from that. We still make money each year from giving the flu vaccine. So this is basically, we truly feel we don't want to harm our patient, and hopefully by doing this, we inspire other healthcare systems start to use their own conscience instead of just follow the government guideline and, without choice. Yes.
As an
please.
investor in the Atlantis healthcare, I have a concern because how many patients are we going to lose who are steadfast set on getting the flu vaccine, who are now going to search elsewhere?
That is a financial concern. But since we provide such a good health care, so even they have to go to get a flu shot from CVS, Walmart, they can get it anywhere. I'm sure by doing that, they won't just left us and not coming back for other more qualified care, like an ultrasound, x-ray, surgery, or something like that. Your flu vaccine, you can get it at any corner of the street now. And we really have to follow our conscience that we don't want to harm our patient. Yes, Aaron?
Yes, would you recommend any alternatives, homeopathy or something else in lieu of the flu vaccine, since we're not doing them now?
Yeah, that part, it's very controversial. So there are different physicians in our healthcare system provide alternative care. So that's beyond the scope of press conference today. If you're interested, please make an appointment with a holistic practitioner, homeopathic specialist, and I'm sure they will answer all your questions. Thank you very much. I hope we get this message out.